Last week, I had surgery to remove a 14-centimeter ovarian cyst called an endometrioma, and I also had other endometrial tissue removed. When I arrived at the hospital, things went well. As soon as a woman checked me in, a nurse arrived to take me back to day surgery. I went through the regular process of getting dressed in a surgery gown and reviewing my medical information with the nurse. Everything was smooth sailing. 15 minutes before my surgery start time, the anesthesiologist arrived in my room. She told me she was only going to be using the drug propofol to put me to sleep for the 3-hour procedure. I told the doctor I do not tolerate propofol. It is contraindicated with mitochondrial disease. The physician argued with me that propofol is safe to use in patients with mitochondrial disease. I told the doctor I have developed severe muscle weakness in the past with propofol. I asked if we could use something else. The physician said she would have to do some research. She left. A few minutes later, the surgeon entered my room. He talked about what may or may not be done during the surgery. The anesthesiologist came back into the room and interrupted the surgeon. She began asking me questions about past surgeries and the drugs used during those surgeries. The surgeon listened to the conversation and became furious with me. He started screaming at me that I should have had all this sorted out before coming to the hospital. The surgeon said none of this was indicated on the medical clearance letter from my primary care doctor. He told me I should have seen the doctor his clinic recommended and should not have been evaluated by my primary care provider. I said the pre-op instructions stated I could see my primary care physician. My doctor did everything which was asked of him in the pre-op instructions. The surgeon blew up in a hot rage at me. He said if I would have seen his doctor, none of this would have happened. Although the surgeon was frustrated, I highly doubt seeing the surgeon's recommended doctor would have prevented this from all occurring. The issue was the anesthesiologist only wanted to use propofol. I do not tolerate propofol. The anesthesiologist needed to find a different drug to use. When the surgeon and anesthesiologist left my room, I was devastated. It seemed as though everyone was at odds with me. I was extremely upset. A short while later, my nurse arrived to draw some blood. She stated the doctor wanted to get a baseline to know if I was stable enough to have surgery. When the blood work was completed, I was left alone again. Another hour passed. Anxiety welled up inside me. My surgery was now delayed by over 2 hours. I left my room and wandered the halls. I desperately wanted to escape the confines of the hospital. I found a nurse and asked him if there was any update on my surgery. He said he would ask the charge nurse. When I got back to my room, the charge nurse visited me. She told me there was a concern I was dehydrated. My surgery was canceled. I quickly told the nurse I was not dehydrated. I had run IV fluids overnight and I only disconnected right before arriving at the hospital. The nurse said she would relay this information on. When the surgery nurse came to give me an update, I immediately informed the nurse I ran IV fluids overnight. I was not dehydrated. The surgery nurse told me they were taking the next surgery case to the operating theater, but now that she had this additional information, she would try to prevent that from happening. If the next patient was taken back to the operating room, I would lose my surgery time slot. My surgery would be canceled. The nurse raced off to find the anesthesiologist. A short while later, the anesthesiologist arrived in my room. She apologized for not knowing I'd run IV fluids overnight. She said she was concerned with me having mitochondrial disease. I might have become dehydrated overnight. The anesthesiologist said she talked to a physician on the phone who was an expert on mitochondrial disease. The mitochondrial disease physician gave the doctor an anesthesiology protocol to use for my surgery. Now that the anesthesiologist had this protocol, she felt much more confident about what drugs she could and could not give me. The anesthesiologist said she needed to get another blood draw, this time testing my lactic acid levels. Now that she knew I was hydrated, she was going to push for the surgery to happen immediately. As soon as the lactic acid levels came back, I would have surgery. The anesthesiologist drew my blood. The nurse then raced the test tube down to the lab. Less than 10 minutes later, the surgery nurse was in my room. My medical equipment was gathered up, and off to the operating theater we went. After a 3-hour and 16-minute delay, I arrived in the operating room. I am very grateful I was able to have surgery, but the entire process was extremely stressful. I hope and pray I do not have to have any more surgeries or procedures which require anesthesia. I never want to experience a situation like this ever again. Thank you so much for joining me. Please remember to like and subscribe down below. I hope you have a great day and a wonderful week. Bye-bye.